Okay, good morning, doctors, wherever you are. I'm glad you're attending this morning because I've got something that I'm excited to share with you. We have a member, a lot of you know, or if you're following or you're tracking in on the Facebook user group, you know that Todd Pickman has been doing a lot of things with the Smart Injury Doctors program, and what he's going to show you is what he's been doing with it, what he's created with it, and then he's going to also show you what you can do with it. So Todd, I'm going to turn it over to you, and I'm going to change presenter, make you the presenter. So you'll just see hit yes.
Okay, let's see. Hold on one sec. I got to set up the permission thing on my end and go to meeting. Yes. See, go to meeting will not be able to record the contents of your screen until it is quit. Okay. It might kick me out and I come back in again. That's what it's saying on my screen. So I'm going to hit this and I might just jump right back in. Give me a second.
Yep.
Okay.
Yep.
Restart. If you apply changes and rejoin, click restart. If you quit changes. Restart what?
Should be just, should have been just a button to share your screen.
Yeah. I think I'm here.
Good.
All right. Can you,
I don't see
it.
Yeah, we can all hear you. I can't see it yet though. I can't see your screen yet.
Go to meeting, like to record. Okay. Yeah, I've never had to do this before, asking me to do all this stuff on my system preferences to allow it to share the screen. Anything now?
You want to, no. No, I don't see.
I'll share my webcam. Let's try that. Is my video on?
Your video's on.
Cool, so video's on, and then how do I share my screen?
Okay, I'm going to make myself, I'm going to change me back as the presenter. All right, and then I'm going to make you the presenter again. And you should just have a pop-up on your screen that pops up.
Show. Oh, there we go. It'll do it now. Cool. All right, screen 2. Show my screen. And can you see my screen?
Yeah, absolutely.
Cool. Awesome. All right. Good. I thought I was going to restart my computer there for a second. I was getting a little nervous. Okay. Well, hi, everyone. Dr. Todd Pickman from Move Now University, Gonstead Spine and Wellness. I'm a full-time practicing chiropractor. So I practice full-time, and you may have heard the story before, but just real briefly how Dr. Kronk and I met is probably back in November of last year of 2019. That's when I was really, something switched on me and I said, you know, I feel like we have a really awesome clinical setup. And I think that our clinic is best equipped to handle personal injury. And I'd like a better way of reaching out to these attorneys and getting them on board with what we're doing. But first and foremost, admittedly, there was a lot that I needed to learn about personal injury. And then I came across Dr. Kronk's program and SmartInjuryDoctors. It was a no-brainer, jumped on it right away. It was actually one of our doctors inside of our program, inside of Move Now University. It's a program where we teach chiropractors how to put functional rehab into their clinic. He told me about your program, Dr. Kronk, and then and that's when I looked at it, joined it, and I started going through everything. And I reached out to Dr. Kronk and said, man, I think this with functional rehab is like the perfect marriage. He looked at our program, thought what we had was really cool, and then we've just been collaborating together. And so my style, as far as how I roll, is I like creating stuff. And 2 weeks ago, when I had a lot more time, or no, it was probably about 3 weeks ago, when like the whole coronavirus stuff really started shutting places down and decreasing volume. Fortunately, our clinic's still open, but the volume was so reduced that I had more time. So I took a concept that we do with our patients in clinic right now to educate them on our clinical process. And I built out this thing to send to attorneys. Okay, so that's what you're looking at right now. Is you're looking at a doctor, friend of mine, Dr. Singyapro. He's been a member of Move Now University for 3 years. He heard that I was building out these platforms for other doctors to be able to duplicate what we're doing out here. He was the first to jump on board and say, let's do it. So I built this for him, and I'm going to show off his process, or explain his process as we go. And then if there's questions as we go, you can jump on, we can answer questions about how this works. Literally yesterday, I pulled like a 12-hour day building a funnel to be able to sell this process to you guys here, so I could send you to a link and you can get access to it. It's something I'm limiting per region. So depending on where you're at, if there's 2 doctors too close by, I'm gonna have to tell the second one, sorry, this other person already got in, because this is gonna be per region. So there is some exclusivity involved in this. But basically what it is, in long and short, I'm going to pull you inside of our training portal here, and then I'll jump back into this in a second. I got a million windows open over here. Okay, so here's what we got here. This right here is a training portal that I built. So I've been busy for the last couple of days. This is all brand new. There's literally one person who has access to this right now, and it's Dr. Rowe, who you just saw. But this is exactly how we're building this thing out. Is we have this process, okay? And I'm going to pull this up on the screen so you can see it. Is that clear enough for you, Dr. Kronk?
Yeah.
Do you see that okay?
Yeah.
Okay, cool. Okay, so here's how this works. We all want to reach out to attorneys. We want to get them on board to understand that what we do is great, start referring their clients to us. And we also want to have attorneys that are well educated, that if we have a patient to send to them, they're not going to fumble the whole thing and roll over and play dead with the insurance company, because the insurance company is saying it's only a small injury, soft tissue injury, it should only be $3,000 of care. But you want an attorney that understands what you do as much as you want the attorney to understand, or sorry, as much as you want, let's see, how am I saying that? You want a attorney to understand what you do as much as you want to understand how the attorney works, so that you can work together to help your patients, their clients. It's a win-win for everyone. So ultimately, the attorney needs to get educated on what you do. So this is something we put together. I actually have a physician marketing liaison that I had hired a couple months ago, and she was going into attorneys' offices and she was trying to develop relationships with them. And it was kind of a slow process. And there's the gatekeeper at the front that doesn't let her in. She tries to bring some little goodies to them. And getting in front of the attorney was really, really hard, okay? And so I said, in the coronavirus times, and in the sense that she's already tried to get in a certain way, and some of it was working and some of it was just very slow going, I thought, how do we fast track the process? And the solution I came up with that I wanted to try was, could we fast track the process by getting a automated video sequence in front of the attorney, something that starts like this, that we amp up the importance of why they should watch it, that when they push play, the first thing that comes out over the speaker is going to entice them and make them want to watch it. If we could do that, could we pull them into a process of watching a sequence of these short videos to educate them, to then get them either in a face-to-face or on a Zoom meeting with us? So we've got their attention, we start that process, and then we can develop the relationship. That was what I was trying to do. And I was kind of forced to have to do that because my marketing liaison, Kate, couldn't go out in person anymore anyway. So now she's just trying to reach out via email, which was hit or miss. And I said, let's have something really cool to be able to show them. And so she sent out these emails and said, Dr. Todd is working night and day on these videos, and he's doing this really awesome thing. And here's what these videos are going to entail. And then she bullet pointed it out. And so she adapted that whole email message as we went on. We fine-tuned it, and it's worked so far. Okay, so it's been 2 weeks into it. I've spoken with 9 attorneys on Zoom calls. All of them have been highly qualified people. I am all of these attorneys I've spoken to. I'm now going to meet with them and starting in approximately 3 weeks from now. That's when we're planning out, assuming that life will be a little bit more normal. They're going to come over to my clinic. I'm going to give them a tour, and then I'm going to take them out to lunch, and then we're going to nurture that relationship following. But what we've already done with them right now is something that would take so much more time and energy, and we found a way to shortcut it. And we found a way to do it, I think, in a more a much more meaningful way than we could if we just met with them and did a presentation in person. Because I took probably 2 hours worth of content and information and stuffed it into a 15-minute process that like hyper educates them quickly, gets them super locked in, seeing all the benefits of what it means for them to work with you. Okay, so how am I doing so far, Dr. Kronk? Am I kind of like explaining the foundation of this?
Yeah,
All right.
fine.
Okay, cool. So now here's how this flowchart thing works, and then I'm going to show you how this whole thing looks. D group is the group of attorneys that we're looking out. That's just any attorney that says they might be doing PI to some extent. All right. So it says on the list may do some PI or all PI. We start this outreach process. The in-person stuff is on hold right now. Okay. So we're not doing any outreach on hold. So it's all going online. It's all going phone calls, emails, LinkedIn requests. And then once they give you permission on LinkedIn, then you can send them a message on LinkedIn. So phone call, email, LinkedIn, we're sending them emails. What's the email say? The email's just trying to ask them how they're doing and say hi and get them to respond, right? Sometimes they don't respond, sometimes they're a jerk. Rare. Most of them have been really responsive and really cool. So if they're a jerk, or they say they're not interested, or they say, you know, screw off or whatever, we give them a thumbs down, they put you on the see you later list. If they say anything other than that and they respond, we give them a thumbs up, and then we move them into group C. Group C is now, they've responded, they sound interested, we had some kind of good vibe with them. So now this is where we introduce AIV, which is Attorney Interactive Video. And that's what I'm going to show you today, is how we did that, and then how we have then duplicated that for other chiropractors, which is really exciting because we've already done this for Dr. Rowe, and we're going to do this for hundreds of other chiropractors. We have a way of doing this where it takes us maybe 48 hours turnaround time, where you sign up, you do this, we build it out for you, and it's built, and then you can duplicate what we're doing. So C group, introduce AIV, phone call, email, LinkedIn. We're telling them all about this video series that they should watch, that's going to be to their benefit, and they're going to love it. And then we get them to actually watch the videos. Okay, so now once we've sent this out, we put them into group B. They've watched the videos. We then schedule a Zoom meeting with me, right? Then we have ways of reminding them and making sure they show up for that Zoom meeting, and we've worked that out too, to get a very high show rate. Okay, we've had like, I don't know, 90% show rate, you know, like once or twice people have had to reschedule last minute, but for the most part, people are highly engaged with this, is what we're finding. The attorneys are highly engaged. Then after I meet with them and I go through and I talk with them, and then I show them this PowerPoint presentation that highlights our documentation, and it took me like 20 hours to make this PowerPoint presentation. I made a training video on how I do the PowerPoint presentation. I ran through it with Dr. Kronk. He gave me some feedback on it. So it's been looked at by a lot of different sets of eyes here. Then what happens is we move them into group A, and the goal is to get as many people in group A as possible, and then go through these steps to basically nurture and meet them in person. And you just nurture that indefinitely, and the goal is to get as many people in group A as possible, and you do it through an automated process, and you just track it along the way. So group D, C, B, A. So hopefully I did a clear enough job explaining that. Now inside of our training portal, we have this process, starting the outreach. So how do you start the outreach? What do you do with group D? I go through the training on this with my marketing liaison as far as how we mapped out how to do this. I took every single document, the phone calls, the emails, the LinkedIn stuff. So you click on this and it just downloads a Word document. Let's see if it pulls up okay here. And yep, right here. Okay. So right here, it talks about the scripts as far as how we go through this whole process. And this is the stuff that actually works. This is not theory. Okay, this is proven. So phone script. Okay, what happens if they say no? All right, what if you get them on the line? You know, if they say yes, the script goes as follows, or if an attorney answers their own phone. Okay, so general questions asked, ways to answer. I mean, it's all mapped out here. And we got phone calls, emails, LinkedIn. Okay, so then we have group C. So when they get to group C, same thing, phone call, email, LinkedIn. You see the whole trend of this, right? All right, so it's every document that we made, we put inside of here to share with you, and we did training on it. Okay, so that's just the start of this. Then we have the second part is and I'm looking tired here because I was exhausted. Okay, it was like 1 in the morning when I made this video, but it's still a great video. This is the PowerPoint. I go through this PowerPoint. PowerPoint is pretty awesome too. It's pretty on point. I'm gonna show a little bit of that PowerPoint actually in this video so you can see it. Let's see, because I highlight. Okay, so this time a little bit about clinically, and then we get right into the documentation part, which is what they want to hear about. Let's see, come on here. Maybe I'll just open my own PowerPoint on my end. Let's see, it's probably my only thing. Yep, here we go. Okay. All right, so this is my PowerPoint right here. And this is where we start for the most part with the attorneys. Let's see if that slideshow pulls up. Okay, cool. You can still see this okay, right, Dr. Kronk?
Totally, perfectly.
Cool. So this right here is after they watch the video sequence. I know I haven't shown you the video sequence yet, but I'm going to save that so I can build some anticipation. I know some of you have already watched it. I've shared links before as far as showing it off. I was so excited when I finished it. I was proud of the work on this, but I'm going to show you how we customize this for other doctors, and we can customize it for you. But right here, documentation wise, this is what we show the attorney. This is exactly how I would explain it to the attorney. I'm going to take you through like you are the attorney, okay? And you just watched this whole video sequence. We talked on a Zoom call for a while. You told me about how, yeah, it seems like you guys got it together. It seems like you guys are doing a lot of what I wish all the chiropractors that we work with do, because it would make our life so much easier. It would protect our clients so much better. And they go on and talk about that. And I say, hey, John, something I put together is I actually put together some slides from some real documentation from a patient that I'm seeing right now. And I put it up there just in case our conversation went this way, so I could show you a little bit about how we do our documentation. I'd love to show it to you and then get your feedback on what you think. Is that okay? And then they say, oh yeah, sure. And then I pull up my screen and I show them, I go, okay, well, here's how this works. So on day one, patient comes in, we do our initial evaluation, we make sure all injuries are documented, we detail it out in the notes, we have examination forms. And then let's say they have like an extremity complaint, we have extremity forms. So everything is just documented out. We have a form for everything. We leave no stone left unturned. Okay, that's first and foremost. The second thing we do is we list our guidelines. All right, so we have this in our notes. The following guidelines are those that we adhere to in our clinical practice. We list them out. Why do we do this? Because it protects the doctor, it protects us if we're attacked by the insured for overutilization. So like right here on my desk, I don't know if you can still see me at all, or it's just my screen you see, right?
Both. We can see both.
Oh, you can see both. Okay, so right here, I have this auto injury solutions. Yeah, you like these? And these are a bunch of notes that I put on here after going through, and thanks to Dr. Kronk, he gave me some good feedback. Auto injury solutions. So what's auto injury solutions? That's the place that tries to attack you, and they'll put their little study at the bottom that they quote, and they'll say that's the guideline. But like Dr. Kronk has taught me, that's not how it works, is that we are the attending treating physician, we're the treating doctor, so we're using established recognized guidelines. They have to prove that we didn't follow the guidelines that we state that we adhere to, right?
That's correct.
So protects the doctor if attacked from overutilization. So I show them that, okay? And then day one, we do examination and stress x-rays. Detailed exam findings, we do the orthopedic testing, the neurological testing, the stuff that you expect to see, okay? Now I'm back talking to John, our personal injury attorney. Okay, this is now, and then whatever we find here is related back to x-ray or the CRMA, which I'm going to talk about in a second, which stands for Computerized Radiographic Mensuration Analysis. What is that? It's a fancy word for a very advanced, concrete way of analyzing stress x-rays. So what's a stress x-ray? We're going to take flexion extension x-rays when there is any sort of neck trauma or neck complaint. If there's a low back issue, we do this in the lower back. This is just one such example. So we take these x-rays, which a lot of practitioners don't even take the x-rays, but even those that do take the x-rays sometimes don't even know what to do with it. They don't know what it means. They're not measuring anything on it. They're not relating it back to what they found on exam. We are doing that, but even more so what we do is then we send these x-rays out to board certified medical radiologists. So a unbiased third party checks these out, and I'm sure everyone watching this, because you're all part of Smart Injury Doctors, you probably hear that in your sleep over and over again, because I know when I was going through Dr. Cronk's videos, you hear that over and over again. Is we send it out to board certified medical radiologist, unbiased third party. But those are really important talking points, and that's a thing that satisfies a certain thought in the attorney's mind of, oh, so are you marking these in-house and then they're going off of your measurements? Nope, we send them off to a unbiased third party, and they go, oh, okay, good, right? And then what happens is on day 2, things move forward with the patient. Here's how we continue to document. So now we've sent out the x-rays. Those are going to come back in a couple of days. I'll get back to that in a second, but we're going to move on with the patient. We're on day 2 now. And on day 2, what do? We go through and we document and put in the notes loss of enjoyment factors. There's 5 categories: work activities, domestic, household, education, and sports activities and hobbies. And these are things that a person can no longer do because of their injury, because of the accident, because of how they're living their life as a result of this stuff. We also document duties under duress, things they can do but are painful or limited or changed because of their trauma. And same 5 categories. Now this right here, and yesterday, mind you, I spoke with 2 attorneys yesterday. Both of them, this right here, they go, oh, this is huge. That's what they said. And one of them told me that he works with so many chiropractors who don't do this on their own, that what he does is he has his own form that he gives to his clients, and he has his client take it with him to the chiropractor, and then he asks the chiropractor to put that in his note. It's like trying to do the job for the chiropractor who's not doing this, which, now granted, I didn't used to do this either, okay? So I'm not saying like I've always been perfect doing this. I'm just getting all my ducks in a row as of several months ago also, so I can do a better job with personal injury patients. So day 2, how we practice, this is what we do inside of Move Now. We do a lot of functional movement. Attorneys love this as well because it's very objective and it helps tell the whole story of what's going on with the patient. There's research to point back to. It's comparative, meaning you can retest their movement over and over again. And it's just a better style of clinical care, really. So day 2, we go through, we go through all of these movements. These are evidence-based movements. Then there's studies to reflect back in FMS and SFMA, the selective functional movement assessment. This is our own type of movement assessment where we've taken movements out of these other assessments and put them together because we find it gives us even more quicker to implement clinical data to execute on with our patients. It's called the Move Well 3. This is something that we teach inside of our program. That's a whole other thing. But we go through this different movement assessment, we grade it. So that form over there is our grading form that we follow. And then this is retested throughout so we can see how someone is improving or things that are still hanging up. So now, remember that those x-rays we sent out to Spinal Kinetics, we get the report back. This is a real life report that we had of a patient. She was 26 years old, had a concussion, hit her head, had severe neck pain, difficulty sleeping, headaches, pain in the neck, mid-back, shoulder, elbow, wrist, knee, multiple things going on with her. And turns out when we got this back at C3, you can see that she's got 3.57 millimeters of excessive motion, of translation. So when she bends forward and bends back, that vertebra slides back and forth. This is how I explain it to the attorney. All right, John, have you ever seen this before? Most of them are familiar with some level of this, but just vaguely familiar, okay? So then I read this to him. I say, so then in this case, it says if it's greater than 3.5 millimeters in the cervical spine, then this is what's called a category 4, which means this can be assessed at 25 to 28% impairment of the whole person when they reach maximum medical improvement. When we close out the case, that's when we're going to turn around and look at this impairment finding and call it a impairment rating. Now, this is right here. I see it's signed by a board certified medical radiologist. This is their finding. This goes into the patient's health record, and then this gets sent off to you. Okay. Now, sometimes at this point, there's a question I've gotten, so I beat them to the punch right here. And this is the thing that you and I, Dr. Kronk, were talking about yesterday, is that when you do this over and over again, you start to predict what people are going to say, right?
Yep.
And so in this case, something I did yesterday for both of them is I just tell them, I say, you know, and a common question or a common thought maybe at this point is, let's say someone comes in and they injure their cervical spine and they have excessive motion, and that's an impairment finding in the beginning of a care. How common is it for that impairment finding to become an impairment rating 3 months or 6 months later? And I'll tell you that in most of these cases, it's about 99% of the time, the person still is going to have that damage there, and it's still going to be a finding and then turn into a rating. And it's similar to, like, if you think about hurting your knee, and this was an analogy that Kronk told me of hurting your knee. If you blow out your knee and you injure your MCL, your medial collateral ligament, you could rehab the knee, you could get out of pain, you can become more functional, but did you and do you have damage to that ligament? And are you going to have issues with that knee to some extent for the rest of your life because of that injury? The answer is the vast majority of the time, yes. It's no different when you're looking at cervical spine, except cervical spine, there's a spinal cord and there's nerves and there's all the stuff around it. So it's much more significant, which is why this holds so much more clout as far as determining a impairment rating if someone has this finding. Okay, so then we take the information from the report, we put into our notes. So these are all macros that we made, and we say CRMA results received. Person's got a grade 3 sprain. It's severe. Based on Croft guidelines, this patient could be allotted 76 visits. Now, granted, we're probably going to see him, 35, 45 visits, so we'll be well within those guidelines. But according to AMA guide, this could be a 25 to 28% whole person impairment. And upon reaching MMI, an official impairment rating will be established. Okay. All the attorneys I'm showing this to are just blown away the fact that we are on top of this step by step. And again, I mean, all of this is stuff I've learned from Smart Injury Doctors from Dr. Kronk. So thank you, Dr. Kronk, for making us so well equipped to be able to do this. Now that I've done it, I'm just showing you how I put it together to be able to present it with just a boatload of confidence. And then I'll show them this. I'll say, in comparison, if you get your thumb lopped off, that's a 19% whole person impairment. But if you have a severe spinal ligament injury in the neck, 25 to 28%. So it's that significant. And most of them already know this, and they're saying, oh, yep, I understand. So now, in addition, John, before I started showing you these notes, you were talking about the importance of being able to properly diagnose and fully diagnose clients, and that was a frustration of yours. Well, that's something else that we also do. We completely diagnose. All injuries are diagnosed. It's one of the most important steps, yet it's commonly missed. And here's why I think it is because many doctors underdiagnose because it takes more time to be thorough. It doesn't really affect their ability to treat the patient or get reimbursed. So they just diagnose what they feel like they need to, and they move on. In our case, we will put the extra time and the extra care into fully diagnosing what's going on. In this case, this patient had 25 diagnosis codes. These are not a bunch of overlapping codes. These are all based on multiple injuries, complaints, and findings that this person had. And there's other things that are outside of our scope, like as far as sleeping disturbances and anxiety. So what we do is we have a team of providers that we know that also understand how we operate. We understand how they operate. We're all on the same page of doing the best clinical job possible for our patients. We then refer our patients to them so they can evaluate them. They can put that diagnosis down, capture it, so that all of the stuff is recorded and properly documented. And then so that right there, I'm beating them to the punch, because they're wondering, okay, are we willing to refer out? Are we willing to work with other providers? Absolutely. If there's stuff that's beyond our scope as far as what we should be looking at or diagnosing, we're going to find another provider so they can get their eyes on it, and then they can document and record this. So then I just show them a couple other slides here about, like, I think this stuff happens as far as people are injured and have all these problems long term is because they're not getting the appropriate care, they're not getting properly diagnosed, and they're not getting in quick enough. And then I say, okay, so question now, how many doctors that you currently work with practice this way? And then I just shut up and I let them talk. And most of the time they're like, none, no one, I wish. And then what would it mean for your clients to have access to this level of care? What do you think? And then also, what would it mean to you to have this level of expertise and thorough documentation? And then next step, do you have any clients that need our help? Yep, anyone, right? And then would you be open to exploring a working relationship? Right, obviously. Cool. And then I exit out of it, talk for a couple more minutes, and then that's when we then go to the next step of nurturing that relationship, getting them in the clinic for a tour, taking them out to lunch, and then my physician marketing liaison will drop stuff off at the clinic and follow up and make phone calls. And what we're doing now, because we can't drop anything off, we just bought a bunch of Starbucks gift cards, a bunch of $10 gift cards. She wrote a little thank you note. I've already sent emails with follow-up SmartInjuryDoctor stuff sent over. So I've sent follow-up emails thanking them. She sent a little thank you note with a Starbucks gift card. And there's this whole process that we're doing, before we talk to them, after we talk to them. But the key thing to get them engaged and have something to talk about is to have them watch this attorney interactive video series before. It's worked phenomenally so far. I'm really excited about it because I feel like we figured something out that has never been done before. Okay. So you can download the presentation. You can watch the whole video here. I go through all the training in even more detail than what I just showed you here. And then let's see. We have funnel training. So I train inside the funnel. So when we set it up, how that works, so that when you have access to it, if you've never seen anything inside of ClickFunnels, which is just the way to make it work, we make it super easy. Okay, super, super easy. So there's just a couple of easy mechanics and we'll help you with it. So if you're computer illiterate, we're doing it all for you. We're helping you with this every step of the way. We're going to make sure that this is fully functional for you and you're using it. All you need to do is have one link in the beginning. You just need to know one link, and that's what you send that link in emails. That's it. That's all you got to do. That sound pretty easy, Dr. Kronk?
Yeah, very easy.
Cool. And then let's see what else. All right, let's go into this. I guess so far there's a bunch of people on here live. Are there any questions so far? Are there any questions that I can answer before I jump into this? Because I don't necessarily have a structured PowerPoint of what to go over. I just wanted to show you all the stuff I've dove into, and then I built out a page that when we're done with this, we can send you a link to it so that you can get access, because it's going to be a first come first serve thing. I'm going to do this super discounted starting out so that we can build this out for as many people as possible. When you see how we're doing it and you see the pricing on it for how much work goes into it, it's going to be a no-brainer. And I think we're going to have I'm going to have a ton of work to do now after this as far as building all this stuff out, because it takes time. I have to do voiceovers. I have to make special slides. I have to edit videos, build funnels, but I'm excited to do it. It's fun doing it. I like doing it. I have a team that works for me that is going to help me. I'm going to train them on how to help me so we can handle this load, so we can turn them around in probably less than 48 hours for each doctor. Depending on how many people jump on this today, I can't guarantee 48 hours for everyone, but probably within a couple days, maybe after the 48 hours for sure. So with that said, are there any questions?
Yeah, there's a highly technical question, and it's not a question for your marketing system. It's a Smart Injury Doctors technical question, because that's all we have on this morning. Dr. Kronk, I've been doing CRMA early and then repeating at the end of care when there can be differences in impairment when an area shows to be worse than the initial report. Now the defense attorney in deposition or trial wants to say that the doctor hurt the patient or made them worse. We can talk about the muscle spasms early in care limiting the motion, but still put the idea in injury's mind talk about it even more in the closing arguments. So how do you recommend overcoming this issue? Anybody that has trained with me knows that I do not recommend that you do a early CRMA and then a CRMA at the end of care. I've never recommended that. That would double Spinal Kinetics business. It's insane that I don't recommend that. And there's a very specific reason why I don't recommend it. And that's because an injury to the ligaments is permanent. It's a permanent injury. That's why I don't recommend, or nobody recommends, if you have a disc herniation, that at the end of care you have a re-MRI. Nobody ever sees that you have a re-MRI at the end of care. That's a ligament injury. So I don't recommend, and it's something we could talk about at another time, but I do not recommend pre and post CRMAs. I never have. I never, in the whole history of the time since 1995, since I've been doing this, I've never recommended that. So whoever made that recommendation or whoever is giving you that information that should be done, you're following something that I in my program have said, don't do that. Now, there's too much to go into on like re-CRMA, patients when early. We have doctors that use different types of x-ray systems. Some use out-of-house systems. Those out-of-house systems are shot by different techs. The standardization of the re-x-ray is not good. There's a lot of things that I could go into there that I'm not going to go into, but I did want to answer the question that you actually had. So go ahead, Todd.
Yeah, I think it's a great question. And mind you, yeah. I mean, that's something that, just to be clear, that's not something that we're doing or we plan to do either, as far as doing a comparative CRMA. There's a lot of comparative stuff that we do for ourselves, but one of them is not going to be a comparative CRMA. It's, I mean, we're comparing movement patterns, we're comparing objective findings, subjective. But yeah, it sounds like doing that just introduces a variable that you really don't need to introduce. All right, so right here, this is now the step-by-step video that we built out for Dr. Rowe. And so how it works is I can just play, like I'll probably play the first couple of videos on here. I don't want to just play all of them on here because we can send you to a page that I built that has all this information here. Let me just see. I'm going to pull this over here real quick, and I'm going to see if my first page. This is a page I built yesterday. I'm going to pull this up real quick so I can see, and I'll show you what I'm going to. Okay, cool. So this right here is a page that I made that when we're done here, we'll send you the link so you can go to it. And the cool thing on this page is it highlights all the stuff that we have in the program, as far as all the different training and the attorney presentation and the custom videos that we make. And we make a 5-step custom funnel so that you just send them to the very first link of the funnel and it takes them through this process, which I'll show you here in a second. But here's what you can watch too. If you want to watch these videos in full, details on each video. So there's an overview video. Actually, this is probably a better spot to show this to you than what I was going to show you before. So I'll blow this up and I'll show you here. So details on video. So this says attention grabber. So for example, if I play this. Let me ask you a question. What if you found out that you may have left tens of thousands of dollars on the table for improperly documented injuries on personal injury cases that you've settled? This brief video series was designed on behalf of Dr. Singyup Rowe at Rowe Sports Chiropractic, and it's important that you are investing the time to watch what we have put together. We are confident that you will see the dramatic difference this will make in every case that you settle. Not only will this help you better serve your clients, but this will drastically change the way that you look at injuries and what you look for in the doctors that you trust for your clients' care. The truth is, most doctors and many attorneys are only seeing the tip of the iceberg when it comes to treating and representing these personal injury cases because they do not know how to dive below the surface. Dr. Rowe has devoted his focus to fully understanding, evaluating, and documenting the full extent of uncovering and properly treating these injuries. Because of this expertise, healthcare professionals and patients alike trust this approach in order to best address these trauma-related injuries. The reason that we built this educational resource for you is twofold. Dr. Rowe is looking for attorneys that he can trust with his patient referrals, and he wants to be the resource that you can trust for your injured clients. Our clinic takes care of patients that suffer from spinal ligament injuries as a result of trauma, from car crashes, work-related injuries, or just overall life. And we believe that when appropriate, these patients will benefit greatly from the help of a skilled attorney that also possesses certain qualities. Not to start on a negative note, but I feel it will be easier to begin with discussing the qualities that we're looking to avoid in choosing an attorney to work with. Here's what we don't want. Number one, an attorney that values volume at the compromise of quality. This usually occurs because the attorney hasn't been exposed to the systems to differentiate between a basic injury approach versus a process that utilizes the most research-specific and up-to-date evaluation, documentation practices, and treatment protocols. This leads to quick and smaller settlements at the expense of a patient left with undiscovered, unresolved lifelong injuries. Number two, the attorney who already knows everything. The biggest hurdle for most professionals to cross is the openness that there may be a better way. This occurs most commonly because the professional is stuck in the "this is the way we've always done it" perspective, even though the latest knowledge in the environment is rapidly advancing. Number three, the attorney who isn't interested in long and lasting referral relationships. Our core values are excellent patient care and loyal relationships. We have established being a trusted resource in the community, and we're looking for attorneys that share these same values. Now, onto the positive side. Here's what we are looking for. We're looking to build strong professional relationships with attorneys who are always working to stay at the front of the bell curve, meaning they are lifetime learners and are always striving to improve. You see, these are the same traits that we value and practice in our clinic to ensure that we provide the best care possible. In the next video, I will show you the hidden spinal ligament injuries that MRI was never designed to uncover that are the true value of your client's future health and the benefits that they are entitled to. So that right there is a version that we made for Dr. Rowe. So it's customized for him. It's got his name in it, his logo in it, and then it goes through this whole process. So the second one's on spinal ligament injuries. This is probably the most awesome video in the whole one. I'm tempted just to play it. It's 5 minutes. What do you think? You think I should play it right now?
No, go ahead and play it.
All right, let's play it. Let's do it.
Now I will reveal to you these hidden spinal ligament injuries that are routinely missed across the board. So doctors and attorneys alike are falsely led to believe that MRI is the highest level of diagnostic superiority in the imaging food chain. This is simply not true. So first off, what happens when your client is involved in a trauma and injury? Did they see it coming? We know it makes a difference whether they were braced for the impact. Was their head turned one way or the other at the time of the crash? These risk factors definitely do matter, but what matters most is not the mechanism of injury, also known as the force delivery system, but rather the injury or the derangement pattern that is left behind. So what does that mean? Every injury leaves a biomarker, evidence that is consistent with the type of injury involved. So an injury such as hot grease splashing on the skin will leave a burn. A gunshot will leave a bullet wound. A dog bite will leave bite marks, and a motor vehicle crash will oftentimes leave a measurable injury, identified as an imaging biomarker that many in the healthcare profession are blatantly missing. This costs the patient a missed diagnosis and tens of thousands of dollars that they're rightfully entitled to. Let's dive into some anatomy and biomechanics to make your client's case bulletproof. Okay, so into the anatomy of a functional spine unit. A spinal unit consists of two adjacent vertebrae in the spine and all the ligaments and connective tissue adjoining these two segments. With trauma, a vertebra can shift abruptly, damaging the ligaments that hold them together. The most talked about ligament in the spine is the intervertebral disc. And while the disc is a very important structure, it is not the only important structure. As a matter of fact, it is only one of 10 ligaments that connect two adjacent vertebrae. When your client has been involved in a trauma, the disc may be injured, and that can be serious and very important to properly diagnose and treat accordingly. When you think about a disc injury, what type of special imaging immediately comes to mind? That's right, MRI, magnetic resonance imaging, the gold standard for detecting and quantifying the extent of this type of ligament injury. So here's the problem. There are 10 ligaments between every two adjoining vertebrae in most parts of the spine. That's right, 10. In the big picture of things, it is reported that there are over 220 specialized ligaments throughout the entire spine. Of these 220 ligaments, 23 make up the discs, meaning that the discs only represent less than 10% of the ligaments in the human spine. So if a doctor orders an MRI to assess the extent of your client's spinal injury and it comes back normal, now what? Clean bill of health? Everything must be fine? Just a soft tissue injury? No. If the doctor draws that conclusion, they just did their patient and your client a huge disservice if they didn't further conduct the proper testing to assess the other ligaments in that area of the spine. That's right. Spinal ligament injuries are the #1 cause for pain and disability in the world today, and most doctors routinely fail to properly diagnose them or treat them accordingly. Sorry, Mary, the insurance is only offering to pay a portion of your medical bills, and there's no money left over because you had a low damage collision and they say you should be better by now. Have you ever said this to a client before? How would you feel if you found out that there was a simple and accurate bulletproof test that would have proven beyond a reasonable doubt that Mary was injured, allowing her to get the care she needed, the compensation she deserved, and the case value that was appropriate? But Mary's doctor didn't know about the test, and neither did you. The good news is, we're part of the SmartInjuryDoctors network, so we have all of this covered for your clients. Okay, so how do we find these hidden spinal ligament injuries? These are discovered on stress radiography and a comprehensive examination that relates back to these findings. Specific measurements are performed on these X-ray images to determine if there's something called excessive motion. This means that a bone in the spine is either bending too far or shifts too far when the spine is moving. The really powerful thing about this test, they're backed up by well-established guidelines that have been published by the American Medical Association. These are called AOMSI, or Alteration of Motion Segment Integrity. The injured party either does or doesn't have a relevant finding. It is objective and powerful for your client's defense. One of the most powerful components of how we document these injuries is by working with an unbiased third party that performs the measurements and documents their findings. That means that we send these excessive motion X-ray studies out to board-certified medical radiologists for them to interpret and produce the report, clearly quantifying the extent of your client's injuries. Last thing to circle back around to is this idea of it's only a soft tissue injury. This phrase was coined as a result of insurance companies downplaying the significance of a person's injury in order to aim at minimizing the settlement. This is practically meaningless in the clinical realm as far as defining the severity of one's condition. The body is comprised of both hard and soft tissues. The hard tissues are bones, and everything else is considered a soft tissue. So things like disc, other spinal ligaments, brain, spinal cord, very crucial structures that when damaged make up the absolute worst kind of injury that you can have. In the next video, I will uncover the top 5 mistakes most healthcare professionals are making that are killing your clients' insurance benefits.
So that's that. I'm not going to show you all the videos, but you get the gist of it as far as how it works. So it really covers all the stuff as far as my interpretation of what I learned in SmartInjuryDoctors of what was going to be the most important to be able to talk to the attorneys about. And so you see a lot of the language, a lot of the slides come from SmartInjuryDoctors type stuff, like talking about dog bite and bullet wound and all that. And so this script, I wrote the script, I went through it with Dr. Kronk, got feedback from him on certain parts of it, and then I built it all out. So this is really customized for SmartInjuryDoctors. It's perfect for SmartInjuryDoctors, so much so that this whole access to getting this built out, it's kind of like a prerequisite. Like you pretty much have to be a SmartInjuryDoctor, or you have to join SmartInjuryDoctors to be able to put your money where your mouth is, because if you're going to be giving these videos out to attorneys and telling them that you practice a certain way, you better make sure you practice a certain way, right? All right, so then we talk about the 5 critical mistakes, and then our unique approach, and then what you can expect from us. And then at the end of what you expect from us, it goes to a little button that says schedule a call to chat further. And then when you click on that, it goes to a Calendly page. I'm not sure if we set this up on this end of the funnel. I don't think this button is set up right now on my end, but basically what you do is you click it, it pulls up Calendly, they schedule, or you can reach out directly. And so what we do is we customize it, we put all your info in here, and we also did some training videos on how if you want to further customize it after we pass it over to you, you'll know how to do that as well. But That is the main thing that I wanted to show you on here. And then if there's questions, we can go through question and answer. I was hoping that at the end we could open up for questions. Is it possible to bring people on audio questions, or is it only typed up on text? How does it work through this?
No, through this, yeah. If they want to ask questions, if they have a mic, they can open up, raise their hand, and ask any questions they want to.
Cool. All right.
So, yep. Sorry, I had my mic away. I don't know what my volume was like, but yeah.
Let's see if there's any questions. If there's not any questions, I'm just going to start making up some questions, and we'll see what kind of answers we can have for those assumed questions. Questions that I could come up with if I was putting myself in your shoes, watching this for the first time, and you're thinking, okay, how do I make this thing work? Or I'm not very tech savvy. So as far as that whole thing is, you don't have to be tech savvy with this. Literally, it's all built for you. It's all done for you. And all you have to do is have one link in the very beginning, and that will be a unique link that you send out to attorneys in your area. And then that takes them through this whole process. So that's it. Like, all the tech stuff is done on our end, and all the video editing and stuff is done on our end, and you'll be happy for that, because that's 40+ hours of work as far as building out all the videos. And then from start to finish, it's probably about, let's see, I just added it up yesterday. I think I got like 15 minutes and change from start to finish. Something that I can speak to on this, because some people might be thinking, well, people are so jammed on time. Are they really going to watch it? Are they going to really go through with it? The whole reason I built it like this is because to date, I've had over 800 patients go through a similar process in my clinic. So that's a pretty good sample size. 800 patients go through a process where on their day 3, when we're going through their financial report of findings and their care plan, I have a similar setup like this, where they learn about what we do clinically. They learn about the process in our clinic. And in the clinic, it's about a 20-minute process. And I always thought, man, sitting someone down and saying, watch this 20-minute video seems like you're handing them a big, heavy bowling ball to hold on to for 20 minutes. Versus if you say, hey, sit down and watch a series of brief videos, a handful of short videos. That's how I explain it to my patients. That's actually how we verbalize it in these emails and phone conversations going to attorneys to get them to start watching this. All you need them to do is watch the first video, and it sucks them in. And then buttons pop up on the page that tell you to go to the next video. They see below how many videos they are, so they get an idea of how long it's going to take. They go through the process. The feedback that I've gotten from these attorneys is really, really awesome. Actually, I'm gonna pull something up here that I have on my text message. I remember Kate, our physician liaison, sent this to me last week. She sent me a picture of a text message from one of the attorneys. It was a text message, or it was an email. Let me see if I have this here. If I don't put my foot in my mouth, I can find it. But are there any questions that you can think of, Dr. Kronk? Like maybe questions that you think some of the doctors on here might think?
Some are asking the questions that are more on the Smart Injury Doctors side. I have a doctor here that says, can we send this link in an automated email follow-up system, and do you provide that as well? He's asking, did you set up an autoresponder? Essentially is what he's asking.
Yeah, so an automated email. Okay, so give me the scenario in which you would want to send the link to an attorney in an automated format. Like meaning, I guess, are you trying to do it where you want an attorney to opt into something that you're advertising for, and then when they opt in, it then sends them a link to this for them to watch it?
Probably, but doctor, you really don't need that. That's not something that you would need. And just so everybody understands, I mean, this is a Smart Injury Doctors group. So I'm gonna change presenters here. Let me go back, show my screen. Good, so y'all should see my screen, correct?
Yep.
All right. So let me go to where we are. All right, so y'all know this program. This program here is to teach you. This program here is to get your staff to be able to help you to deliver what you yourself have to understand what to deliver. That's what this is about. This is about making sure that you actually understand when you're in a depot, all these things that I tell you to do. And I don't tell you, hey, interpret what I'm telling you to do. I'm telling you to do what I tell you to do. Don't interpret what I'm telling you to do. So you say, well, here, I think I got a better way to do it. I'm telling you to do it that way. Now I'm telling you to do it that way from years and years of experience of what you can experience in here. Now, because a lot of you haven't spent any time in here. You haven't done 50 depositions yet. You haven't been tested in trial. And you actually haven't had a very aggressive approach to questioning what you're doing and why you're doing it with a high level, highly paid defense attorney, not the run of the millers. I'm talking about the cream de la cream. Now, when you have that, you go, oh my God, now I know why he said, do this, do this, do this, do this. Now, what Todd's in, we have a marketing program, right? If you look at the marketing program, you go, hey, we got a marketing program that does internal marketing, attorney marketing, marketing for physician's assistants. And in here, I'm giving you all ideas on how to do this marketing. Now, what Todd's done is he's taken for his clinic and he's automated it. He's automated this. He's automated attorney marketing. He's automated this. Some of you may want that automation. You may say, I don't want to build out my own automation. That's what he's presenting to you today. He's presenting to you that he's taken this information in here and automated it. And now he can automate it for you if you're interested in having that automated. So that's where we're at with this morning, right? So I highly recommend, here's what I'm gonna tell you. As smart injury doctors, anything that you can do to get attention is what you want to be doing. You want to be grabbing attention right now. You want to go ahead, get out. Hey, I've got this video series. I want you to watch this video series. And then I want to set up and follow up with the office. Dr. Pickman is probably one of the most organized members that I've had. He's very organized and he's very fast. So you want to look and say, hey, is that something I want to create, or do I want to do that on my own? If you don't want to do that on your own, take him up on his offer, right? I'm going to tell you this, in 30 years of private practice, I have never bought a product that I didn't gain from. I have never bought a product. Now, I'm starting to make more and more statements about this. I have spent literally probably on products, coaching, training, and everything that I've done, easily $500,000, right? So I've never had one. I've had some that I like better than others. So there isn't any like, oh wow, if I purchase this product, would it help me? Absolutely, 100% it'll help you. Absolutely, 100% it'll help you. When we were going over with Dr. Pickman on what he's doing in his clinic, one of the key questions I asked him when we were in Facebook Live groups and things like that is, once you set this whole program up and you hire a full-time person to administrate it. So full-time person, Dr. Pickman is not out there going out to all these attorneys. He's actually hired somebody to go out, full-time person. Good. How many cases do you have to receive from your attorney marketing, just your attorney marketing, in order to make that break even? It was a case every other month, right?
It's just half of one case a month. Yeah.
Half of one case a month. Now, do you think he's going to get half of one case a month? No way. He's going to get a lot of patients, and he is going to convert over from 2%, 5%, 10% personal injury to 30%, 40%, 50% personal injury. Now, the other thing that's beautiful with his and how he's set up, and why I like his setup so much, is Move Now You is functional rehabilitation. Functional rehabilitation works whether you're talking injury practice or you're talking chronic pain practice. It works the same. The more you understand injury, the more you understand chronic pain. The same things that cause injury cause chronic pain. So, for you doctors out there, whatever questions you have, ask the questions. I mean, ask questions now. Let me see. Cost, I only allocated till 11 a.m. for this. So they want to know the cost.
Yep. I can show you that right now. I'm waiting for the approval from my web guy to just make sure everything works that I built yesterday. I was up late last night and he's checking it right now. We're like at the final touches of building this thing because it's so hot, fresh off the press. Are you back sharing my screen?
Oh, I'm sorry. No, hold on. Thanks for reminding me. Good. Should pop up for you now and you should be able to share it.
Okay. Which screen do you see? Are you seeing the one that says what you expect?
Yeah, what you can expect from us.
Okay, you're seeing that. Okay, cool. Let me show you the how this breaks down. Okay, and I'm pricing this low. Okay, like starting off on this, I was contemplating charging a couple $1,000 for this, like $2,500 for it, $3,000 for it. I was just thinking about how much work it took for me to put into it, and I figured instead of doing that, I would launch it out the gate for less. So it's $1,300 is how it works. So normally in the future, I am gonna crank this price up, absolutely, but I'm gonna do $1,300 right now since we're just launching it. And how this works is there's a page that we'll send you to that you can get in here, and you fill this out, you put your info in, and you'll be in. Okay. Now, something too, let's see. This is what I wanted to show you. This is what I was looking for real quick. This is an actual email from an attorney that I spoke to this last week. He sent this to Caitlin. She's our marketing liaison. So notice the subject: unattached patients looking for representation in personal injury. That's what she sends out. You think that gets their attention? Yes. He writes back, "Hey Caitlin, I did have a chance to watch the videos. Thank you for the link. I appreciated the quick hits about what you guys can do. I like the portion of attorneys we don't want to work with. It reminded me of the firm I used to work for." I thought the videos were good, and I learned things I honestly was not aware of, especially when it comes to MRI and spinal damage beyond just the discs themselves. I also like the focus on proper diagnosis and documentation. I just had a case recently where almost all the providers, the other side of the state, did an awful job on documentation, kept everything so basic and vague, it was difficult to obtain a great settlement because I couldn't point to solid objective findings. Overall, well done. This is pretty much the feedback we get from everyone that goes through this. They love it. So it works incredibly well. That was a question on, oh, and then as far as the link to send you to, let me make sure. The link is going to be the one that I texted over to you, Dr. Kronk. So here, let me find it real quick.
Can we put it in the Facebook user group? Because I'm like,
yes, it is PI, like personal injury, dot move now. Oh, he said he just, oh.
Can you type it in?
Yeah, it's just wait about 10 minutes to jump into it because he's making sure everything I built out and set up is good. That's basically how I do this. Like I built a lot of this, but I have a techie guy that tests it to make sure it's all going to work. So wait 10 minutes to go to the link if you're watching this live and you want to jump on it now. But what it is, let's see, is there a text here where I can text or I can type it?
Yeah, we could. If you tell me what it is in the chat, or you can type into the chat.
I see it. So it's pi.movenowyou.com/dominate. You like that link?
Yeah.
So pi.movenowyou.com/dominate. So if you click on that, it'll take you to the first page, and that's how you get into it. Okay.
Perfect.
So wait. If you want to click on that link, doctors, you can, but just do me a favor, wait 10 minutes before you actually get inside of it, just so we can make sure there's no bugs in it. I just got a text from my guy. He said 5 minutes. 5 minutes, he can give me the approval. What are the questions we have?
Let me look. Anybody that wants to raise their hand and ask a question, just go ahead and ask a question. All right, so we handled cost. I don't have any other questions here.
Okay.
Give the link again. So it's, if you write down PI, let's see.
Yeah.
Sorry.
Yeah. So it's PI, like personal injury, movenowyou.com/dominate. Here, I'm gonna put this up on a Word document here. Give me 1 second. Actually, here. We'll go. Come on, just updated a bunch of stuff on my computer and the format's all different. Okay, so pi.movenowyou.com/dominate. There.
Perfect.
Okay, so that's it.
That's where you want to go to, doctors. That's what you want to go there, check it out. And I'm going to highly recommend that you do it. I mean, basically, if you don't have something that you're doing right now, and you're not the person that says, hey, look, I'm going to take a PowerPoint and just go meet, or I'm not going to jump on a Skype call, or you're not that guy, and you want that automation. You want that automation, and you want it walked through. This is perfect. Go buy the program. Go use the program. And I'll tell you what, right now, you buy it today. You study the hell out of it today. Because I'll tell you what, the time right now for you to build and expand your injury practice is right now. It's right now through the end of the month, through the end of May, through the end of May. It's going to be slow as hell, except for in the injury practices. Like I said, I was on a webinar yesterday, the day before. I've been on a lot of webinars. And I said, look, injury practices that are 50 to 60% injury are not experiencing they're down 20%, 30%. The practices that have this extreme mix, 90, 10, PI to regular insurance, they're down 80%, right? So
Yep.
injury work is recession proof. It's totally recession proof. So you could study this material and start to be up and running next week, right? You could be up and running next week. Now, if you got one new personal injury patient from one attorney interaction with this program, you paid for the program. And if you haven't paid for the program, something's seriously wrong, right? You're seriously undercharging for what you do. So, you know, for me, like I said, when I said, look, I spent easily over $500,000 in personal, in products and services and personal enhancement. And if I added all the books and all the rest of that stuff that I've ever done, and maybe the softwares I purchased, probably more than that. I don't know. I have to take a total assessment at some point, but I'm a buyer. I buy things and then I put them to work and I use them. This is something to buy and put to work and get using it. How big is the exclusive area you referenced?
So it's really going to be based on demographic. It's going to be somewhat based on where you live. Because, like, for example, if I said, well, it's a 10-mile radius, but if you live in New York, I mean, that's crazy, right? Because that like wipes out a lot. But if you're in Idaho and it's a 10-mile radius, I think that's reasonable. So that's like pretty much how it's going to be, is join it. Once you're in it, the first thing I'm going to do is as people join, I'm going to look where they live, and I'm going to look at existing people that are in it. And if there's a conflict, the newest person that joins, that's the person that I'm going to have to say, sorry, I can't take your money. I'm going to have to refund you because Dr. Jones is close by you. So it's somewhat subjective according to me, or if someone can make the case, but I'm looking for how many attorneys are there, how many people are there. For example, like per capita, it's based on how dense a city is. Okay, so if it's something like New York, it's going to be a smaller mile radius. If it's something like Idaho or most places that are fairly like kind of standard, not huge cities, it's going to be approximately a 10-mile radius. I think that is reasonable. But you know what? That whole question and that whole thing, just to let you know, because this was a question doctors had from me years ago inside of Move Now, is they said, hey, is there a certain exclusivity thing? Now this, the reason that I said that and offered that up here is because I knew that would be a question. But inside of the Move Now end, literally, I have almost 160 members. We only have 2 people who are 10 miles apart, and they actually teamed up and they work together. Everyone else is spread out, so it doesn't happen as often as you think it's going to happen. But I am going to do my best to make sure that when someone gets this, that there is not someone in their vicinity that we allow in. So it's a first come, first serve thing.
All right, good. Does it come with the PowerPoint that you were talking about?
Yes, it does. And then also too, I just saw that we had Dr. Greg just joined. Awesome. I think it's Greg. I just see the email on my phone. But something else to you guys is on the second page, guys, when you join, it's a little surprise attack I put in there. It's called an upsell. What's the upsell? We also built this out for physicians. It's called the Physician Interactive Videos. And how that works is that it's the same way. It's that there's a video on that page where I explain it. So watch the video, don't click through it and say, no, I'm not interested. Watch it, because these two things are going to go together really, really, really well. And it's that once you've reached out to attorneys, we're then switching our approach to go to medical doctors. And so I made different videos with different messages for medical doctors. So I slightly tweaked them, wrote different scripts, and then that's where you can get unattached patients, and then you can refer them to the attorneys that you've built these relationships with. And that's also a thing that I talk about when I go through that PowerPoint. That's what I'm telling these attorneys that we're going to be doing as well, because is that our first plan is to get a handful, and like handful can be a subjective amount. Handful for us is 50, but a handful of attorneys. And then we're going to shift our focus to really branch out to the medical community. They'll be driving in injured people who are unattached cases that are going to need representation. That's where we now need you, Mr. and Mrs. Attorney, to be there and to carry the baton and help our patients out. So it completes this whole process. So on the second page, after you opt into this, you have the option of being able to get the physician interactive videos as well. And that's something that we also customize out for you.
Perfect. And the first set of videos has a portion about your practice. He's assuming that's part of this. That's correct. I'll answer that one. So yeah, it's practice specific.
Yes. So like the first part says this is done on behalf of Dr. So-and-so, has your picture, has your logo. All the outro videos have your logo. So it's all branded to you. Says nothing about us, says nothing about our practice. It's all about you. It's all about you, and it mentions Smart Injury Doctors in the second video.
Good. Okay, good. All right. Any other questions? I don't see any other questions.
Cool. Well, as these come in, this is where I'm going to start running through and building these out. So I got my work cut out for me, doctors. So jump on here. There's a bunch of doctors on here this morning. This is going to be sent out as a replay to people who are not in here live. And but it's going to be a first come, first serve. So if you want this done quickly and you want to get it in a couple of days, jump on it right now. And I'm just going to start mapping these out and building them in the order that they came in.
Perfect. Perfect, guys. Cool. Jump on it. Yeah, I don't have anything else. Todd, you have anything else?
No, that's awesome. If you have any questions for me,
awesome job.
Yeah, thank you. If you have any questions for me, you can reach out to me on Facebook. I'm inside of the Smart Injury Doctors Facebook group, so you can always reach out in there. Dr. Kronk, are you going to post a link or something to like a replay, or maybe you could send me the replay and I can put it on a page and I can put it inside the group too?
We'll post it. Yeah, I'll post it.
Cool. Awesome. All right. Well, thanks for having me on.
All right. Thanks for taking the time, Todd. And doctors, thanks for being on this morning. Jump on this, get this. It'll help you to actually get out and get some attention from the attorneys and get more new patients in and expand your practice while you're sitting here. You want to expand now so that when the expansion of the economy starts again and everything starts to open up, you're already expanded. You don't want to wait till everything's already expanding. You want to be expanding before it's expanding, so you're already expanding, so you can ride further expansion once the economy starts to open up and the expansion starts to occur. So, doctors, thank you very much for taking the time to watch the program this morning, and we're going to let you go. Thank you.
Cool. See ya.
Bye-bye.